Today we are going to perform injection for plantar fasciitis. Here you can see the comparison between the affected leg and the normal leg, and these are three cardinal features that we see in plantar fasciitis. First of all, it's the thickening. Usually in plantar fasciitis is more than 4 millimeter, and you can see in the long axis of the affected limb it is thickened. But when we want to do the injection, usually from the longitudinal axis it is not possible, long axis it's not possible to inject. So we have to change the orientation to the short axis, and under short axis usually from medial side we insert the needle, and under the ultrasound we try to put the needle just above the plantar fascia, that is just superficial to plantar fascia. Especially if you are injecting steroid, we should be careful. It should be slightly superficial because plantar fascial rupture is also reported when it is injected inside. And now under vision we have to inject the local anesthetic steroid mixture just above the plantar fascia, mostly at the superficial layer, and now we should take it out. The whole process to be done in a sterile way. At the end we are rechecking again under long axis view, and here we should see the fluid. Just we are also injecting now, so it should be just above the plantar fascia, that we can see the fluid layer just above the plantar fascia in this image. So the patient is expected to get relief within 2 weeks, and usually there could be an initial pain for injection. Thank you.